Hello everyone, I'm Mary Rose Corrigan, Public Health Specialist for the City of Dubuque with the December 1st, 2021 update from the Dubuque County Public Health Incident Management Team. Dubuque County and the entire state of Iowa continue at high transmission for COVID-19, with the COVID case rate for the last 7 days at 391 per 100,000 population and a 7-day positivity rate of 12%. So even though COVID-19 cases took a dip this past week, overall the new cases climbed significantly on a weekly basis over the past month. And so far this week, the numbers are not looking great. Why is that? Well, since about July, the number of people getting vaccinated has almost flattened, with slow, slight increases in those fully vaccinated. And this is even though we know vaccination greatly reduces the odds of contracting COVID and even further reduces the chances of hospitalizations and deaths. We also know having COVID infection or illness provides immunity for a few months. But even with the over 18,000 people who have had COVID cases in Dubuque County so far, and the 59% of the population that's vaccinated, it's not enough to keep those unprotected, non-immune individuals from contracting the virus. This is evident in our school age and young children as the 0 to 17-year-old age group continues to have the highest number of cases. Adding to our community vulnerability is the fact that both vaccine and natural immunity to COVID-19 wanes or decreases over time. That's where the booster dose comes into play. Now, everyone ages 18 and older should get a booster shot either 6 months after their second Pfizer or Moderna dose or 2 months after their J&J vaccine dose. And by the way, if you initially had J&J vaccine, you can receive any of the vaccines for your booster. It's your choice. Boosters are available at your doctor's office, walk-ins at the VNA, and by appointment at local retail pharmacies. And for a complete list, visit the City of Dubuque or Dubuque County's COVID website tab. And yes, it's true that some who have been vaccinated are now contracting COVID-19 illness. They are experiencing that waning immunity. Studies also are showing that immunity from vaccination is stronger than immunity from having disease. Which brings me to my next point. And I've said it before, the longer the virus continues to circulate and infect people, the greater the odds of variants developing. And now we have a variant of concern, Omicron. Now, in not only the southern African countries where it was first reported, but also in several other countries like Canada. And yes, like the other variants, this one is named after the Greek alphabet letter Omicron. Yes, this is the real pronunciation, which I learned from a person of Greek descent. Meanwhile, CDC Director Dr. Rochelle Walensky stated, the recent emergence of the Omicron variant, B11529, further emphasizes the importance of vaccination, boosters, and prevention efforts needed to protect against COVID-19. Early data from South Africa suggests increased transmissibility of the Omicron variant, and scientists in the United States and around the world are urgently examining the vaccine effectiveness related to this variant. In the meantime, we are waiting for further details about Omicron as they emerge, including severity of illness, degree of transmissibility, and vaccine effectiveness. In Iowa, the State Hygienic Lab continues to sequence or test approximately 300 positive COVID-19 samples each week to look for variants, including Omicron. The Iowa Department of Public Health is also monitoring travelers from southern Africa into Iowa. Last week in Iowa, the unvaccinated accounted for 74% of hospitalized COVID-19 patients and 82% of ICU hospitalized COVID patients. The fact that COVID-19 vaccine prevents severe illness and death is clear. Another thing to be mindful of is our local hospitals are busy, and hospitalized COVID patients have remained high for at least a month, and now they are housing more patients from seasonal illnesses and conditions like influenza, respiratory illnesses, and those having procedures, and things like falling on the ice. So one way to stay out of the hospital is to get vaccinated for COVID-19 and for influenza. This will leave room for all those who need emergency or unexpected hospital care. So in the next couple of weeks before the holidays, prepare for being healthy as we gather with family and friends. Vaccinate. Stay home if you're ill, and even if it's with a mild cold or flu-like symptoms. It could be COVID, but even if it's not, you still don't want to spread your sickness to others. And it's been a while since I've given a pep talk on getting adequate sleep and plenty of physical activity, along with eating a balanced diet with plenty of fruits and vegetables. You'll feel great and may avoid those extra holiday pounds. Now go get that booster or encourage your family and friends to do so.